So this normally was a checkoff sheet, satisfactory, unsatisfactory, and it was kind of like a grid. I'm pretty sure you guys are kind of familiar with that. The students come in for their test out, and you just check, okay, yep, they did step 1, step 2, step 3, step 4. So now we've changed this pressure ulcer care test out to include the critical elements. So the critical elements that we included in this one were patient safety, identifying the patient, maintaining infection control, and maintaining sterile technique, because we wanted them to practice sterile technique again in the course, even though we know that pressure ulcer care may not always mean that they need to maintain sterile technique, but we wanted to include that as part of their test out. Patient comfort, looking at pain control and patient positioning. Prevention of injury, we were looking at nursing interventions that focused on pressure ulcer injury prevention.
Program that is correct, and you come out with an associate degree in nursing, which allows you to take your registered nursing.
Promotion of healing. I think someone has their mic on.
License.
Promotion of healing, we focused on wound healing stages, assessing your wound, and selecting the appropriate dressing for the wound, the different stages of the decubitus ulcers, and then they actually had to do a wet to dry packing. We presented the case study situation. It was an 80-year-old that was admitted to the rehab unit. They were hospitalized.
Okay, is that a bachelor's degree or an associate degree? Bachelor's degree, okay. That would, it doesn't really.
You just see who's on.
Some of the courses, the general education courses that you took for those degrees probably would transfer in for hours.
Your end,
because it's overseas.
There we go. Thank you.
Probably,
and we found who needed to be muted.
Actually, check with our
so this patient was an 80-year-old, basically came to the rehab unit,
you would get
to the skilled care facility. This is a long-term care
course that looks
at geriatric patients.
Degree, so that shows that you've been successful in college, which is great. And so that gives you a few extra points.
We muted
see the point sheet
Michelle
online
on
that we
our
had?
end.
We got it now.
Okay.
Okay. Okay, that's all right. But that would give you
Sorry
some
about
extra
that.
points there.
Can you call
So
her
anyhow, this patient, we stuck with the culture for the course. We stuck with the course setting. They developed a pressure ulcer injury. And so basically it takes the students through. So they had to complete these questions prior to their test out. When they came in for their individual student test out, faculty reviewed their response, individual responses with them. So we wanted to know what their priority assessments were. So looking at the assessment cues, right? Were they able to document the wound and the stage of the wound in their assessment? Were they able to implement the appropriate interventions? Then were they able to perform their packing, their wet to dry packing on the wound? And then we wanted to know what additional information would they like to have. So this is just an example of one that we've tried. We just tried it just summer and fall. We're in the process of trying to do this with some of our other courses and some of our other lab test outs. Thoughts, discussion?
Now, what courses were you using it for? You said in the summer. So is this a associate or PN? And was it like Med-Surg 1 or skills?
We're an associate degree program, and it was used in our NUR 141 course, which is it's kind of our geriatric course. So we run summer and fall. So we run year-round. We're a year-round associate's degree program that runs 2 separate cohorts.
Okay.
They do it on the paper, Betsy, so they have to answer the questions, but then they do come in the lab and actually perform the skill. And then we ask them those questions or even more questions kind of based on what answers they are giving us.
Okay. So it is more the beginning or, level 1 skill or level entry and everything that you're starting. So are you kind of thinking about the next step of like, okay, when we get to MedSurg 1 or 2 or whatever your thing, kind of asking more in-depth questions or, kind of building on this? Or I don't know if you had any thoughts of the next step.
We're in the process of that discussion with faculty right now for winter. This course is a level 1 course that is term 3 of 6. So they can test for their LPN at the end of that course. This is the first time that they've had the pressure injury stuff. That's where our test out for that is. So like our program is set up so like each course has their individual test out. So like this course does trach test out. They do an IV maintenance test out. They do the pressure wound test out. They do a mobility test out. It just is what relates to that course content. Then our next course after this, they ran this fall, they run again in the winter. So they're in the process of trying to figure out how can we take it from this level to go to that higher order of the psychomotor skills for that course. And that course will focus on more NG insertion. They do trach to vents. They are more of a med-surg type 2 course where they are kind of ICU, ER, med-surg, cardiac focused. Where this course that we just showed you, that course is half of the semester they go into long-term care facility, and the other half they go into the acute care hospital for like chronic disease. What you guys have for ideas for Next Gen with like in the lab setting from maybe other conferences you've attended or what your program is doing? Are any of you guys doing where your students, like for test outs, like our program, our students have set test outs every course. We have like 5 or 6 test outs that each student comes in and they test out and they know they're going to be tested out on that test out. So that was like an example of the skill that course is testing out on one of their skills. Does anybody like draw from a hat where they say, okay, you're going to have cath, sterile dressing, trach care and G-tube, IV, and when you come in, you prepare for all 5 of these, you come in, you draw from a hat, and that's the one you're testing out on? Do any of you guys do that?
Betsy, you guys do all of your skills for the program first semester? That's interesting.
Well, this is Lori again, just trying to help out with conversation. I had a couple thoughts. We're associate degree program, or at least for our ADN, and in the fall, they do have their skills lab, and it is the full semester, and we do everything from NG tubes to dressings, sterile dressing changes, medications, that progression, so they get everything. And then it's pretty well they go into med-surg and their OB and peds and everything. So, and then I was going to add that, as far as what we tried, because we found that after the summer, they come back and they're very rusty. Like most of us go on vacation, we don't think about work or things. So this fall, and for a couple of reasons, we needed some program assessment feedback, but we said, well, let's do a skills review. And it's going to be for our sophomores or, the following fall. And we did select 3 different areas. We weren't sure. We said, let's pilot this and see how it goes. So we did med administration, sterile dressing changes or fields, and then application of oxygen. We saw some weaknesses from our full-time clinical instructors. So we had the checklist, and they would come in and they knew that they were coming in to do this checklist. And it was very interesting that I helped check off, it was like per clinical group. So it was part of their clinical time, but they come to campus and they went through and I don't know how many messed up their sterile gloves. I had one gal open her sterile drape and plopped it right down on the table and then picked it up to open it. And it's like, yeah, they're a little rusty. So by the later groups, even later that week, because it was our first half clinical groups, and they were much, much better. So word got out that, and again, it wasn't punitive. It was more just review. We wanted to see how they were retaining the information. And then, do we need to do this, every fall? So we just had our second half groups go through and did quite well. So again, hopefully they practiced up on it and everything. So we are kind of planning to continue that and maybe even build with some more of the skills. We just went with like a 3-hour time frame with a few of the skills, but we're almost thinking we need to increase it and incorporate, especially maybe indwelling catheter. I don't know, nasogastric tube. We don't see that so much in the hospital that's something they get as much practice, but definitely things that we want them to know and retain. So hopefully that's where we're to that point of like, we don't refresh every semester on things, but definitely should we, or at least doing the skills review at the beginning of the fall semester for our sophomores is something I think we're definitely going to continue and even try to expand on a little bit.
So it wasn't like pass or fail the students. It was more of
and we said, for remediation, and what I did is my group went through and I said I had several with, we had the checklist. So either they were unsatisfactory, satisfactory, or excellent, and then I wrote comments of, put on the wrong glove first, or, as far as the process. So when we were all done, the plan was we would let instructors know, hey, we saw some weaknesses here. And I did send out, a kind of a group email saying, I had quite a few that didn't ask about allergies, fully identifying patients, because we just kind of let them go, do that. And at the end of it, I said, okay, well, let's talk about some of these skills. And the ones I just plopped my sterile drape right on the table, didn't I? And I said, you sure did, that she realized that. So we kind of remediated there and talked about it in hopes that now you're going into clinical. And so far the feedback too, that our instructors felt that they were a little more in the game, thinking about it, with the skills and what they have to do. So we're hoping, but yeah, we didn't really use a pass or fail. It was just more for our collection of data on for our program, and then just kind of truly a refresher for them. So
nice. Renee, what level course do you guys do your patient scenarios and draw from the hat from? We don't have a skills course. All our skills are implemented throughout our program in the courses. Can we unmute them? Let's see if we can unmute you and get your audio to work. RB.
See, I think it's just not hooked up. If they have audio, they're here. If not.
Oh.
We saw that, Renee. Okay, interesting. So I wonder if are we the oddballs? Most people have a skills course.
Looks like a lot of you guys have a skills course that's in the first semester, and then you come back through and you reinforce the skills throughout the courses through your labs. Is that right? What are you guys doing for Next Gen in the classroom?
Are most of you guys all back face to face, or are you doing a lot of online learning still?
Hi, this is Lori Kahn. I'm from Lansing Community College. Can you hear me okay?
Yes, we can.
Yay. I'm kind of feeling your pain with nobody talking.
Yeah, thanks.
Like a class. So at LCC, for one of your questions, right now we are, our classes are online real time, the majority of them. Some of them will be going kind of a combination for spring face-to-face online. So a couple of things that we have been doing for Next Gen. We have one of our instructors at the fundamental level has developed a lot of different learning activities through this H5P program that and actually has created some open educational resources through that as well, that we can use some of those different style questions. She's done some evolving case studies, some like drop and drag type activities. And you know, I teach pediatric nursing, and so I'm just starting to incorporate that. One of the challenges that we're looking at right now is that our learning management system doesn't support a lot of those next gen questions. And so that was a question I had: is anybody have a learning management system that is supporting that? You know, not that I think our college is going to change that just for the nursing program, but what are some strategies? So that's one of the reasons why some of us have started to use that H5P, is because you can do some of those types of questions. I know I've modified a few. I haven't got them into the H5P, so I do have more of like an online like document that they can do that and try to do some of that in class as well.
I see that Nurse Tim has been working with ExamSoft, and they have been trying to upgrade or at least put like the tables from like Microsoft into the ExamSoft. So I think programs that use ExamSoft will hopefully this next year will have some options. But like you said, Canvas or Blackboard, it might be a little more difficult if you're testing it within those systems. Elsevier products, they do have testing as well. You can do an EAQ, the Elsevier adaptive quizzing, and then they have RN Next Gen questions as well. But then, you know, this you'd have to add to probably your program fees or your student fees. Walter Kohlers also has some, Sheila says.
What about like in-class learning? Are you primarily lecture? Are you more of a flipped classroom where it's application activities throughout class, a little bit mix of both?
I'll share, Amy. This is Betsy here. I do flipped classroom for my first semester students in lecture. And some of what I've been doing, because admittedly so, our program as a whole has been a little disconnected as far as who's doing what, and I'm sure I'm not alone there.
Absolutely.
But since I have, you know, the group who's getting that first, I have been very cautious about like changing the language I use in the class. So like when I do a case study or when I, you know, introduce a topic with a story or with images or whatever, I try to use the vocabulary that they're using in that clinical judgment model. So as far as like cues and, you know, the, oh gosh, we just did one this week, a pain case study. And I used another program that we purchased or that I purchased, but I changed how I asked those questions. So like, what's the relevant data? What is the, you know, what are some of those pertinent findings, to really sort of help them start fishing out those pieces. I agree. Someone else had mentioned some of the like Nurse Tim conferences and the whatever. Really the big message I got there that I've been trying to share, you know, with my group is we can't just test different. We have to teach different. Right. So, I mean, that's the kicker. It's what are we going to do with it so that we can test with it? Because that's, you know, that's the fair way to do it. So I've been working a little at a time.
Mm-hmm. Thank you for sharing. Renee, you said you definitely do a mix of both. Students do strong prep. How do you get them to do their prep and do it well and meaningful? If you have any helpful hints. Pray. Yes. Heather and I do a lot of flipped. And just, you know, the students who come prepared, it's so wonderful and they learn so much. But the students who are not, it's hard because they're not getting from it what they should. But I find that I just do a lot of educating again on the purpose of the flipped classroom and why we do it. Holly said, I'm a student services professional dropping in. We're struggling with providing readers for students with disabilities for nursing tests because of ExamSoft. Does anyone have a solution? We would like it for it to be a computer reader rather than a human reader. That's a really good question. I was mentioning that about like the next gen questions coming up because I feel like in general, people aren't as good of readers as they used to be. And now we're asking them to read so much more too, or they can read, but they don't have comprehension.
We have not had any students with special accommodations from the Disability Support Services for any reading accommodations. We have had it for quiet environment, time and a half testing. That has not been anything that we have ran into yet. I don't know if anybody else has ran into that or has any ideas or help with that.
Renee, when do your students get any like class participation points? Or it's just more of like knowing that we know they're unprepared when they show up to class if they don't do what they're supposed to? The quizzes they get credit for in the class?
Another topic that our faculty have been discussing lately in our faculty meetings is having faculty as advisors or mentors to students. We would like to hear if you guys do that and how that's working, some pros, some cons, or some things that work well, or maybe you've learned from developing a program like that.
We're really focusing on trying to catch those at-risk students, you know, the ones who aren't failing yet, but they're definitely in that kind of area where they almost just slip through. Like, so we're thinking if we had some kind of mentoring or advising, maybe we would be able to support them better.
Betsy here again. I am at Northwestern Michigan College up in Traverse City. One of the things we have, our faculty are student advisors, but it's still an issue of getting the right students to actually come talk to the advisors, right? One of the things our college introduced a couple years ago is success coaches.
Okay.
And so we have the resource of a team in our student services offices that do success coaching, which has been really nice because students can get someone actually who's not an instructor or not, you know, tied to the drama and things they'd like to complain about the nursing program, right? And so they have this outside person However, that's also a complicated issue because, as most of you probably know, the studying techniques for nursing are different from some of their other classes. So we have had some challenges there. But it has been nice to have that group because they also have been ones to help us connect students to other services. So they'll help us connect students to, say, counseling, to, the food pantry if they have food and food security issues, or even tutoring if, heaven forbid, it was actually available for nursing specifically. But that's been a really nice program that I've seen some potential for. But again, it's getting the students that actually need it to go or answer the calls.
Right.
Renee says they have a dedicated nursing tutor in the help lab, and that she's a TA in all the courses. So is that a student that is that went through the program? Like, are they a nurse? Oh, she's an RN who also teaches. Okay.
That's interesting. That sounds like a great role. Holly, for your success coach, is that an RN as well, or is that a success coach for the whole college? Interesting.
Holly says that is an RN as well.
How long have you had that, and how did it get started? Was that something that you initiated from your department, or that's something that came from the college? Oh, Renee, so it sounds like you guys have had it for a long time.
Hi, I think I'm unmuted. Okay.
You are, Holly.
All right. New platform. So the success coach, I work in the student services area. And so I oversee disability services and also tutoring. And we have throughout the years really struggled with providing tutoring assistance to nursing students. We've tried hiring peer tutors. We have tried hiring professional tutors. As you know, peer tutors, like if they're a second year nursing student, they're enthralled in what they're doing and they don't have the time to assist first year students. And the professional tutors that we tried to hire, we couldn't give them enough hours to make it worth their while. And so the nursing department, through conversation with us, decided a different approach. They decided to see if they could get a part-time, non-regular, so adjunct, I guess would be another way to say it, employee that they would title success coach. And then that person is paid, I'm trying to think, it might be 20 hours a week. So it's a more significant amount of hours. And they really pieced together some funding for this first attempt. So I kicked in $3,000 from my budget. Our dean of occupational programming kicked in some money. And then our KCC Foundation has a program initiative grant, and they also put some money towards it. So this first year, it was really a team effort. And so I guess we would say this is still the pilot program, but hopefully it will persist. Our EMS department has done the same thing because, again, we've struggled with finding peer tutors to assist those students, and we've also struggled with finding professionals. Hopefully that helps.
That does. Where are you located?
I'm at Kellogg Community College in Battle Creek, Michigan.
Thank you.
Yes.
So it sounds like quite a few have a nurse who supports the program in some way. I'm jealous of that. We need that. Renee, what college are you at?
GRCC.
We're open enrollment admission for nursing too, so we definitely need that support pillar somewhere. And we've been exploring, how do we support them better? That's where the whole mentoring advisor thing came from. So those are really great ideas. I am Muskegon Community College, Holly. What else do we have? Is finding clinical space an issue for any of you? And if so, how are you meeting that challenge?
We still haven't been able to get back into long-term care facilities yet.
Yeah, issue for peds. Yes, we have the peds issue.
And mental health.
What do you do to supplement that? Are you still able to get in? You haven't had to do anything to supplement that at this point for peds and psych? We know Grand Rapids is plagued, Renee. That's why we can't get anything. We're plagued here too, but. Number of Sims. Oh, wow. One of our hospital sites limit our clinical groups to 6 students for this semester. Oh my goodness, Lori. Start beefing up our simulation.
It's tricky when you have to look at your admission numbers and then decide. We've had to as well look at our admission numbers based upon our clinical space and how many students we can take in. Tracy, you bring up a good point about documentation access for students. If students aren't able to document clinically, then how are you supplementing that? How are they meeting the documentation objectives for the course?
Right now, it's just for our freshmen that we have in, and so they just started that hospital rotation. They also use DocuCare, so they're able to get some of that experience through that. And I'm meeting with the CEO of the facility at 3:30 today to try to see what we can do. It's just funny because they are constantly reaching out to me for recruitment, but yet they're not making it a very friendly environment for education to develop the nursing staff that they want to hire. So we're going to have that conversation and see what we can, compromise on. It's a corporation that is for profit. So there's a lot of decisions that are made. In addition, this is the one that reduced our size to 6. We're not allowed to take any patients in isolation whatsoever because of PPE use.
Right.
So there's just a lot of different challenges. So even though we're in the clinical site, the clinical experience isn't the best.
Like you said, then that impacts the, students' retention when they get done to that agency. Like you said, they want to hire, but if they're not having good experiences, it's hard for them to see that as a positive place that they want to work at when they're done.
Right. That's right.
How do we change that though? Because I feel like that happens almost everywhere.
I just wanted to add, this is Lori from SC4, and I work with Tracy. And, you know, she mentioned the DocuCare, and we were using it in our simulation, you know, when they, or not simulation, sorry, but their skills lab. They would do a dressing change and they would have to document. So we're trying to get them used to documentation and everything. But we also are clinical groups, and not just at this facility where we now find out we're limited, but all of them. That was something we added as well, that they could not document in the extended care facilities, which we haven't been able to do for years. And they would do their assessment profiles, but we're using that DocuCare in lieu of to actually, okay, this is what you did at the extended care. You're going to document that in this document or DocuCare system. So we've had that, trying to use that even more to get the money's worth out of it, but also to increase that documentation. So.
Our students use Epic, but they don't have really a lot of Epic training. I feel like they kind of get a little bit from the faculty as they get ready to go in, and they have to complete some HealthStream modules on Epic. But a lot of it is they're learning as they go, and they're learning through that documentation piece at the agency. A big discussion that we had amongst our faculty was who's going to co-sign that student documentation. Is it going to be faculty in the course, or is it going to be the RN at the agency? Who's really responsible for that student's documentation? Sheila has a question for those of you that use DocuCare. Can you use it across the curriculum, and how's it set up?
This is Lori, and like I said, we use it mostly in our skills our first semester. We could continue if I wanted to do in Med-Surg and continue documentation, or we've even considered after our lockdown and clinical all had to go online or alternative methods, that if we had that, we could use it for continued documentation and things like that. So we haven't used it past our first semester and skills and everything, but we do like it. I said even they order entry and for documenting vital signs, the whole thing. You could use it, throughout your whole curriculum and everything. And they do purchase it, whether for 6 months or a year or 2 years, however long you would need it. So, and actually we used SimChart last year, and we prefer. So can we promote what we liked? And we went back to DocuCare because we do like that better than the SimChart. So.
You guys find that your students right now have a lot of different programs that they're trying to learn between the lab stuff, us trying to do some virtual clinical stuff, classroom stuff. We switched from ATI to HESI, Elsevier.
Can I ask a question?
Yes.
Thank you. This is Holly. I'm going to take us on a different path, perhaps. But in talking about clinical sites, again, I'm from Kellogg Community College and I coordinate disability services. As part of that, I have also been blessed or cursed with the Title IX component as it relates to pregnant students, that whole mess, to be quite honest. We have a number of nursing students who have asked for exemptions to the vaccine requirement that is being implemented not by KCC, but by the clinical sites.
Yes.
And they are utilizing their pregnancy status as a reason. And so I guess a couple of questions. Number one, are all of your clinical sites requiring vaccination? If they aren't all requiring it, do you allow students to somehow select or opt out of places that require it for any reason? So I guess those are the two questions.
Okay, I'll answer first, Holly, for our program, but other people's programs might be different.
Okay.
We only go to basically one agency, and the majority of our clinicals, at least 50% of our required clinical time, is at our one agency that is requiring COVID and flu vaccinations, and they have their policy. However, they had decided that the schools are going to approve or deny the exemption. So the college has worked with the clinical agency to develop, kind of an exemption list, and then the college has a team that was put together to approve or deny the exemptions. And we haven't ran into any problems yet, but one of our concerns is what if the student is also an employee and the student submits the same exemption as an employee and gets denied or gets approved?
Yeah. So those are the other like components of it, right? So we have an obligation as an educational institution to remove those barriers based on, ADA Section 504 or, Title IX, this pregnancy clause. We have been treating these requests or conversations from an employment law perspective. So if it's a clinical site and that employer is requiring all employees, including students who are doing clinical sites there, to be vaccinated, then they would need to work through the clinical site on any exemption that might be available as part of employment law. Now, nothing has bounced back to me, and I've been removed from some of those conversations, but I'm just pretty sure this isn't over quite yet. So I'd be curious what other people are seeing as well. I appreciate your input, Amy. Is it Amy or who's actually shared that?
Heather.
Heather, thanks, Heather.
Our students can either submit a medical or religious exemption, and those go through the committee, and the committee decides, and they have legal is involved, and the exemptions are good for 1 year. So they all had to submit them here about a week ago, and all the exemptions are good for a year.
And who makes up that committee, like position-wise?
I am not exactly sure who all is on the committee. It's the dean is, the human resources team is, our dean of our health programs is the one that represents above nursing. I think that's all that I know that's on it.
Okay, thank you. So it's specific to allied health programs, nursing and allied health then?
Correct.
Okay.
Mostly nursing. We do have an MA program.
Okay. All right.
I don't know what other programs are doing. Does somebody else want to share what they're doing at their agencies?
There were a few chats.
Yeah, wondering if most clinical sites are requiring it. I had heard that there were some hospital systems that were not requiring it. But around here, we have Bronson, both Kalamazoo and Battle Creek, which are pretty huge suppliers of clinical sites for us. And they were moving towards the requirement. Okay.
Hi, this is Tracy from SC4. We have several clinical sites that are requiring it. Our main clinical site is not yet, but they did call asking a lot of questions on how to manage that requirement if and when it comes down. And some of our clinical sites, actually all but one that require it, are asking for the college to maintain exemptions. And then the one clinical site that is maintaining the exemptions themselves, they are not requiring it of their staff, just of contracts, students, and vendors. So I think right now, because it's not required of their staff, it's easier for them to handle. But once some of the bigger organizations that wanted to manage it found out how time consuming it was going to be to handle it with their staff and students, they pushed it back to the college. So our college also has a mandate for employees. So there's a review committee that reviews the employees. So that same committee is the one that will do all health science exemptions, student exemptions, sorry. And to be honest, I really don't, I don't even know who makes up that review committee. I'm just happy that I don't have that from a nursing and from the dean of health science. I don't have, there's no way that they can say there's any bias. So, because I'm not involved. And the people that are involved don't know these students at all either. So we know that it's a fair decision that's being made. So, and I think that's it.
Can you just define HC, agency, Lee?
Healthcare, I think is what she means, healthcare agency.
Thank you. Thank you.
Mm-hmm. I think the biggest challenge for nursing programs, though, is according to the state, only 50% of clinical time can be replaced with clinical replacement. So if you can't go to the agency, then how are they going to get those clinical hours? I think it's difficult with that state requirement.
Our students have been informed if they are already registered for a clinical site that's requiring the vaccine, that their options are they have to either get it or get an exemption. They have to meet the requirements of the clinical site, or they can't progress through the program because they can't finish their clinical. We have not had to go that far, but that is the expectation. They're made aware of it right from the beginning. Talk about it in orientation. They're also aware that, and it changed at the beginning. It was like, yes, they need it. Then I had one that said, no, they don't. So because of how fast moving all these changes are, just being very transparent with the students that, today could be one message, tomorrow can be another, and that they need to think about that because they're getting into this environment of healthcare, and it's going to be the reality. And so not everyone's happy with it, obviously, but there's not much you can really do about it. You have to focus on the things that you have control over. So. I have a question that's not related to this topic. It's completely different. We have from our student nursing advisory committee, the students have expressed, those that want to go on to their BSN, we have a grading scale that's different than the college. And a C is 80%. So they have to have that 80% in order to pass any of the courses. And it affects their GPA, and then it also affects their ability to get some scholarships offered by the universities. And I was just wondering if anyone has worked through how to manage that. We don't want to decrease the integrity of our program, but we also don't want to hinder any financial incentives that the students can get as well.
In our program, our grading of an 80 would be a B minus, Tracy.
Okay.
I don't know what other programs have, but
We have a traditional scale.
we have the traditional scale, yeah.
Mm-hmm. And I've thought about that. Like we could change it to the, traditional scale and keep it the same standard, just the actual grade itself would change, and then their GPA would be, what it is. So we're not really changing it, the expectation, just what it looks like on paper. Okay. Thank you.
Everybody else uses a traditional scale. Nobody else has a altered grading scale like that.
Yeah, it doesn't look like it.
Interesting. Sheila says they use an altered scale.
Sheila, are you getting any complaints from your students that want to advance to their bachelor's?
Sheila said they have articulation agreements with several of the universities to make it seamless transition.
Yes, we do too. And that's why I'm just a little confused as to why.
But the scholarship, yeah, like you said, the scholarship component would be interesting to see how other areas address that.
Right. Okay. I just thought I'd throw that out there because this is, I would say, year 2 of, and it's not a lot of students, but a couple. If one's voicing it, it's probably impacting more than we think. So,
Absolutely.
Okay. All right. So I'm wondering, maybe I have to problem solve that with advising in some of our universities that we have agreements with to see if there's something we can be doing differently. All right. Thank you.
Does anybody else have questions or topics they want to hit before we wrap up today? Hopefully next year we can be face to face. It's a little bit easier to collaborate that way. Thank you, guys.